Hey, it's Dr. Rob here, working in the ER last night, and it's still amazing to me, the last day of March, and I still can't get tests on the people who need tests.
That's Dr. Rob Davidson. He is an emergency room physician in Michigan, and he has been posting a diary of sorts on Twitter. Here is some of what Dr. Davidson had to say last night after Donald Trump and Mike Pence refused to answer a question yesterday about why Donald Trump is not allowing people to enroll in Obamacare.
The fact that in the midst of a public health emergency and facing down the greatest recession in our country, perhaps since who knows when, we have the Trump administration today saying they will not open the federal exchanges for enrollment for insurance under the Affordable Care Act. We're going to have millions of Americans losing their jobs, needing insurance, needing the ability to afford health care. And we had to listen to Vice President Pence yet again stammer his way through a non-answer about how people are supposed to afford health care in this setting.
Joining our discussion now, Dr. Rob Davidson. He's an emergency medicine physician in Michigan. He's also the executive director of the Committee to Protect Medicare. Doctor, thank you for joining us once again tonight. I want to get your reaction to the Trump theme of the day, which is we're just a backup. This should be left to the states. The president is just following and helping out where possible when governors need it.
Yeah, thanks, Lawrence. In my state of Michigan, that may work out okay because our governor's been doing such a great job. But this is a national crisis. This is a national emergency that he declared. And healthcare is a national problem. Too many people, I think 7 million people have lost healthcare under Donald Trump. That's what my committee of doctors has been fighting for. And now with the coronavirus pandemic and the recession that is likely to be setting in, that is just a double whammy for people, losing health care because they lose their employer-based insurance and then potentially facing astronomical costs if they or one of their family members ends up in the ICU. I think it's just criminal that they will not provide a response by the federal government to help these people.
Of course, Donald Trump doesn't content himself to just be a backup. He also attacks governors he doesn't like your Democratic governor of Michigan, who you say is doing a good job. Let's listen to what Governor Cuomo said tonight when he was telling Rachel about how this should be done.
State emergency management does hurricanes, floods of moderate dimension. If they're really big, the federal government comes in. That's what FEMA is all about. States don't do public health emergencies.
And Dr. Davidson, the president just refuses to take that approach to this, and he does it on a daily basis and is justifying himself in doing it. What is that like for you out on the front lines when you know the backup does not go all the way to the president of the United States?
It's extremely frustrating. I think I heard a doctor from Chicago earlier on your show talking about going into battle and feeling like you're just not quite as protected as you should be. I know a lot of doctors speaking out about this, and we go and put ourselves out there. Our nurses do, the people cleaning rooms, and our techs, and yet we have a president who's not willing to let the buck stop with him. As Governor Cuomo said, this is a national problem. The virus doesn't know state borders, like hurricanes affect a certain state or a certain region. This is everywhere in this country. The lack of a national shutdown is just unbelievable to me because, again, we need a national approach and national leadership, and Donald Trump has failed to provide that at every step of the way.
Dr. Davidson, I am in awe of every aspect of your work and how you do it. But one thing I'm wondering about is, in all of this, how do you find the time to listen to these things that Donald Trump and Mike Pence say at the White House briefing, as you did yesterday, because your comment on what they said about the Affordable Care Act was the most cogent comment on it that I've heard?
Yeah, I tell you, I have a lot of people on different text strings shooting me texts, and I sleep a few hours before my shift, and when I wake up, I see my phone has blown up with the latest doozy from Trump and Pence. And I know President Trump said that Vice President Pence barely sleeps, maybe works 20 hours a day. Well, if you sleep, 4 or 5 hours a day, you spend the rest of your time trying to work and then trying to be an advocate for those people around the country and our patients, the people who need us out there, advocating for them.